Acute pyogenic meningitis or bacterial meningitis. Now let's look into the cause of acute pyogenic meningitis. Cause are in less than 2 months of age, same as neonatal sepsis and listeria. In 2 months to 2 years of age, in the world it is pneumococcus, and in India it is H. influenzae. From 2 years to 12 years of age, in the world most common cause is again pneumococcus, and in India it is Neisseria meningitidis. And in more than 12 years of age, pneumococcus is the cause. Let's see meningitis in some special situation. Meningitis in some special situation are patient having splenic abnormality plus meningitis. The most common cause considered is pneumococcus. In CSF rhinorrhea, again the most common cause is pneumococcus. People who are camping or doing closed space living, the most common cause being is Neisseria meningitidis. And in those undergone procedure for shunts or prosthesis, most common cause considered is CONS or coagulase negative staph, that is staph epidermidis. Now let's come to the clinical features. The clinical features include fever, headache, vomiting is projectile in nature, and photophobia. Coming to some special triad of signs peculiar to meningitis are nuchal rigidity or neck muscle stiffness, Kernick's sign, Ski's sign. Kernick's sign include inability to passively extend the knee joint, as can be seen here. How examiner is extending the knee joint but is stuck at around 135 degrees angle. Brudzinski's sign include flexion of hip and knee joint on passive neck flexion. Although above signs being named as per the discoverers, but you can remember it as K stands for knee in the Kernick sign and E for extension. I repeat, K stands for knee in Kernick's and E for extension, whereas in Brudzinski's the B for boat, that is the body becomes boat-like, which isn't possible in Kernick's. Now let's come to the complications. The complication of meningitis may be acute or chronic depending upon the time involved. Acute complications are seizures, septic shock, raised ICP, arachnoiditis or ventriculitis since addition in subarachnoid spaces, subdural effusion, brain abscess, and in chronic complications they are SNHL, that is sensorineural hearing loss, epilepsy, mental retardation, cerebral palsy, hydrocephalus, FND, that is focal neural deficit. Although the complication itself look complicated, but relax, I will make it easy for you. Let's start. Pathophysiology of meningitis. Through this you will remember how a bacteria develops meningitis and how then the complications may develop. This is a bacteria. Here we see Neisseria meningitidis enters the body through pharynx, gets stuck to the mucosa there, and then either through intracellular route or transcellular route reaches the blood circulation. In the blood it is contracted with neutrophils, which releases proteases, which the bacteria protects itself by IgA proteases and polysaccharide capsule. From circulation it reaches the brain, where it enters the CSF. Now, as we know that CSF hardly contains any protective WBCs like neutrophils, etc., thus the bacteria now proliferates rapidly, enjoying a great time in CSF. But as these nasty creatures dance and party in the CSF, they releases their toxins, which are the chemoattractant agents, which are detected by the body's policemen, the WBCs. Soon the party is turned into a war scene, where the worst affected is not the enemy, but the land over which the war was taking place. Yes, the brain. Let's see how. Before diving in, let's recall the path of bacteria to the brain. We can remember this as first comes the mouth, then mucosa, then circulation, and finally the brain. Now let's see how the brain gets injured between the war of two, that is bacteria and WBCs. As we know, any story of a fight start with an inflammation. So do here. As the fight begins, some of the brain tissue gets damaged, further calls the massive artillery of the body. And then the huge battle begins. As mentioned, all the key steps with respect to inflammation are produced, like dilation of the blood vessels, increased permeability, etc. Now, as the permeability of the blood vessel increases, it causes vasogenic edema. This edema compresses the blood vessels, causing arterial constriction, leading to decreased oxygen supply to the tissue, causing hypoxia. And as we know, no oxygen, no ATP, and hence malfunctioning of sodium potassium ATPase, leading to retention of sodium, hence causing cytogenic edema, and finally the cell gives off. Boom! These cells, if we remember, are the neurons. Thus, the patient develop abnormal neurological functions. Like we discussed in chronic complications, we will be discussing the investigation and of course the treatment in the coming video. Till then, stay tuned.